Hi, everyone, and welcome to this HealthBox presentation where I'll be discussing training and adoption of medical or rather medication safety practices. My name is Chirag Lodia. I am a principal trainer for across a whole range of different health services, and currently at Monash Health, I oversee the training and adoption of the medical workforce, the pharmacy department, and any aspect to do with medication safety within the electronic medical record system at Monash. When we look at training and adoption, there are three key areas we tend to look at addressing: digital literacy skills, involving knowledge on how to use and understand e-prescribing software, such as an EMR, and two other terms that are quite synonymous with medications, but a different application in the context of using e-prescribing: adherence, in terms of when is the ability to follow correct workflows and functions of e-prescribing being applied, and compliance, why is the correct workflow function being followed. And those are the three areas that we're constantly looking to address in any type of training or adoption of any e-prescribing software. What we're going to look at across this presentation is three main areas: establishing the e-medication culture when a new employee or a staff member joins any type of clinic, hospital, or other setting involving e-prescribing or e-medications in general; optimizing quality use of electronic prescribing in electronic health records; and a holistic approach to e-medications and medication safety. In regards to foundations training, this involves training of any new employee coming into any given organization. The idea of using the foundations training is to set the expectations, the standards, and provide the appropriate knowledge on how to achieve best use of any EMR system or e-prescribing software. What we did for Monash Health was we set up an e-learning program for different disciplines, medical, pharmacy, nursing, that cover the appropriate context and expectations of how to use the system appropriately and demonstrate end-to-end workflows in an interactive, clickable video. We then followed that up with a webinar to provide a facilitated clinical case to complete within a training domain or practice domain of the e-prescribing system or the electronic medical record system. And the idea here is to apply the knowledge obtained from the e-learning and to refine some of the processes and the intuitive ways of using any such EMR or e-prescribing software. The idea of the foundations training is to set the expectations and key requirements of using e-prescribing system for the initial introduction of the system. When designing any kind of foundation training, we try to keep it short, clear, definitive, and make sure it's active learning, as opposed to passive learning through listening and just watching a lecturer or a facilitator. It's important not to overload the training. It's the same rationale that we apply when educating a patient on taking medications. The same rationale needs to be applied to adopting of an e-prescribing and general medical or digital medication systems. For that reason, not everything can be covered during the foundation training, because not everything is going to be absorbed or retained, even with the best student-centered approach. Just like if you were to try and teach a patient on how to take 5 or 10 new medications that they might be prescribed coming out of hospital, even if you go through all the details possible, they're hardly going to remember all of them. It's important to keep it simple, concise, and direct so that the patient can at least follow the bare minimum requirements. In a similar case for foundations training, you want to keep it to the bare minimum that allows the user to be able to do the prescribing to the best of their ability with the little or the smallest amount of memorization required. From the foundations training, though, you will still need to do ongoing facilitation of training and adoption for best practice. In this case, best practice is referring to the best practice of using an electronic medical record system or any other type of medication prescribing software. And you need to do this to not only improve the efficiency of the users for their own benefit, and you also need to do it, of course, for quality use of the systems to avoid potential medication errors and other medication safety issues. Part of that requires monitoring and tracking the use of the system and patient outcomes. That could be through tracking of KPIs or tracking in the system what functions are and are not being used. Then providing opportunities for prescribers to workshop their difficulties or issues openly and conveniently. So for example, having webinars or video calls that anyone can jump into or jump out of at their need in designated times allows for users to address their key concerns apart from your own key concerns that you want conveyed through the organization. It allows the opportunity for them to get something that they're looking for, as well as giving you the platform to discuss with them about better practices and better approaches to using these systems. Part of that process should involve short and simple key messages and the best practices. Again, similarly, you don't want to overload too many key messages. You also don't want the key messages to be too long-winded. It needs to be simple and tangible and something that people can remember on a day-to-day process. This might also involve them being able to discuss these points in different types of platforms. Those different platforms might involve attending meetings, attending pre-existing forums, and also embedding those key messages into the message and forums of other people. So for example, at Monash, we look at intern training as well as intern tutorials that happen weekly, grand rounds, and other deliverables of training to the medical workforce, where previously that information was being delivered in the context of a paper medical or paper medication record, and working with them to ensure that that education that's being delivered for clinical purposes is also being now delivered in the context of the electronic medical record system. It's also important to provide all of your users with appropriate materials such as quick reference guides, short pre-recorded videos, and self-assessments that allow them to learn and adapt and improve in their own time and space, because not everyone can be available at convenient times of the day. The other aspect of changing the culture requires a holistic approach. So knowledge can be addressed through training and some of the other approaches I've talked about. But medication safety is everyone's responsibility, and every aspect of it therefore requires everyone to be involved. So just like medication safety involves everyone, then the use of the software should also involve everyone. Understanding of how to use the software should go across not just the discipline who needs to action it, but also anyone that's involved in supporting medication safety. In a hospital context or clinical context, that could involve the medical workforce, the nursing workforce, and the pharmacy workforce together, as well as other allied health and multidisciplinary team members. It's important to make sure that everyone understands each other's roles and expectations in that process, and having regular meetings with the multidisciplinary team allows for more collaborative and effective discussion on how everyone can contribute to better approaches on medication safety. It avoids having conversations narrowed and closed off from being a joint effort, such as reviewing and identifying medication errors, but also allows the opportunity for different clinicians to provide a different lens and context to why it's important for patients that the e-prescribing software or the electronic medical record system is being used appropriately. Cultural change always requires a simultaneous drop-down or top-down approach, as well as bottom-up approach. So you need to work, of course, with those at the top of the organization to convey the key messages in a very structured and uniform way, but it also requires a bottom-up approach of learning and understanding why certain users may not be using it properly on the front line, and helping to support and navigate them through their difficulties and trying to bring them up to the best practice approach. Thank you for watching. And if you have further questions, feel free to reach out. Otherwise, we'll see you hopefully at the upcoming conference.